And our guest is here this morning. Dr. Musa Misiani is the Chief Operations Officer at Jubilee Health Insurance. Good morning, Dr. Terry.
Good morning, Joe.
How are you?
Great to be here. I'm fine, thank you. Yeah.
Great to be here, and welcome to the hot seat of Kenya's biggest conversation.
Thank you.
Situation Room. We're going to be looking into health matters today and looking at how innovations have come about in healthcare delivery. But before you tell us what this is all about and we can ask you those questions, CT's got a little bit of an assignment for you. He's got a proverb from Cabo Verde, and he's going to tell us what that is, and then maybe we'll ask you to tell us what it means to you.
Okay.
A hot needle burns the thread.
A hot needle burns the thread.
Simple.
The way I would think about it is, you could have something for purpose, but if you are overzealous, it could actually derail your purpose entirely. Yeah.
If you're overzealous, it could derail
you entirely.
Yes, that is an excellent interpretation. Yes.
Yeah.
It is. It is.
Needle is a needle, but needle and thread make more sense, isn't it?
Yeah.
So now needle without thread, and all because it has decided to become hot. Then yes, you've interpreted well.
Indeed. Great one to start off, I guess. Even as we get now through this, and we're talking about innovations in the healthcare industry and how we can deliver health because of these innovations, let's just start off with Jubilee. I mean, we're talking about Jubilee for a couple of weeks now and getting to know a little bit more of what is up to offer, but then give us a broad base into, who Jubilee is and its unique place in society today.
So, Jubilee is through and through a Kenyan company. Founded in 1937. I'll speak specifically to Jubilee Health, which is part of Jubilee Group. Jubilee Group has Jubilee Health Insurance, Jubilee Life Insurance, and Jubilee Asset Management. We have a footprint across 5 countries in East and Central Africa. But for Jubilee Health Insurance specifically, we are a single-line insurer. We actually specialize in offering health insurance. And what we've done over time, because we've been pioneering in that space for some time, as market leaders, we have been able to push the market into offering solutions for insurance across the life spectrum, right from products for young people all the way through the life cycle to old age, covering both retail customers, of offering also corporate products for corporates around the country.
And even as you look at what the offering is, what are some of these innovations that have come up with? Because somebody would think, okay, yeah, it's great, it's insurance. You pay, you're covered, you move. Yeah. So what are these innovations that we're talking about that have been life-changing in terms of healthcare delivery? So
I think from where we sit, being a single line underwriter actually has allowed us to really specialize in it. And what we've been driving as an underwriter is value-based healthcare, where we try as much as possible to focus on outcomes for our customers. And it's just not about getting the premium. It's really about delivering value, making sure that the customers that we cover not only enjoy the freedom of financial freedom of having a financial cover for health, but they also have access to care that actually permits them to either enjoy preventive care, and in the event that they get to curative care, we're able to cover that financial burden. But what we've been able, again, to do is derive products that respond to that and get into programs that respond to that, driving access. For example, we have pioneered a lot of technology in terms of driving access for care. Telemedicine, for example, is one of those that the pandemic really accelerated. We also offer drug delivery programs. We have a program which navigates our customers. We have that program is called Maisha F, and this has built communities around different health themes. So, be it motherhood, we are able to walk the journey with a mother all the way from conception to raising a child. Be it someone who has, say, a chronic illness like diabetes, hypertension, we are able to navigate that patient and customer. giving them access to the right specialists, giving them the right information, making sure that we follow them up, getting their drugs delivered to them conveniently. And what we've seen with that, with some of these programs, is the fact that then that has helped our customers get better outcomes in the long term. Yeah.
Can we look at 3 of these issues that you mentioned, starting off with telemedicine that came off, just when you talk about COVID.
Yeah.
And then folks were not able to move.
Yeah.
So what does this telemedicine include? What happens here?
So it depends. There's a wide spectrum to telemedicine. It could range from just a phone call to a doctor. You speak to the doctor on the other side, and then they give you health advice. It could extend all the way to a virtual consultation on video conference. And actually, right now, because there are a lot of advances, it may not necessarily be localized here. You can even have remote surgery, because robotic surgery has moved to the point where you can actually have remote surgery. So telemedicine extends the entire spectrum from just consultation to intervention. But specifically to what happens currently in this country, it's largely around teleconsultation. So we have a few providers, and Jubilee was actually one of the pioneers in actually being able to reimburse for telemedicine consultations, where and currently what happens is that a provider is duly licensed as a clinic or a healthcare provider by the Medical Practitioners and Dentists Council, and then that provider then is able to consult, and you can have ranging from, say, for example, you want a diagnosis. Then there are people who offer mobile labs on wheels, and then for treatment you get to a point where you can be able to deliver drugs. So that extent, from consultation to diagnosis to getting the therapeutic agents, that entire journey has been covered in telemedicine. Yeah.
Okay. And what about now drug delivery?
Yeah. So drug delivery actually is, we live in a very convenient world. You want fast food, you'll get fast food. And if you want a cab, you'll just order a cab and get it. So it doesn't then surprise anyone that we would be able to move into a direction where drugs can be delivered, at your convenience. Initially, this started out with non-prescription medication, and then it's moved to now prescription medication. And wonderfully, what that has done, and I'll speak specifically to patients who have chronic illnesses. Often what would happen is every month or so, someone with diabetes or hypertension would have to go to a clinic and see a physician and then get a refill of medication. What the combination of drug delivery and telemedicine has done is you're able to consult virtually, and instead of having to go to physically to a provider, conveniently that those drugs are brought to you. Ultimately, that does reduce the cost of care. Because there is a cost in time that you spend in going to the hospital. And actually what we've also found is just the logistics of delivering the drugs, they end up being cheaper. So ultimately what then happens is you have better adherence to medication, and at the end of it then you have better outcomes for the patient. Yeah.
Okay.
Yeah.
One of the things that you mentioned and which caught my attention was the aspect of preventative care.
Yeah.
Talk a little bit more about this.
So we realize that curative care is very expensive. The technology outlay required to actually deliver curative care is quite expensive. If you take an example of just investment in a normal theater, a laparoscopic tower, getting to robotics and so forth, they're very expensive. Yet we can be able to prevent illness higher up in the spectrum of illness. So if you're in a country like our country where you have a double burden of disease, so you have both the communicable illness, the usual malarias, diarrhea, pneumonia, and so forth. And then now our population is changing. Our population is aging. Our life expectancy is going up. So you have a situation where we still have the communicable illnesses, but at the same time, we also have a burden of chronic illnesses, diabetes and hypertension, as the commonest in our country. So preventive care it actually arrests the illness upstream. And, typically, it used to be that you prevent communicable illnesses, sleep under mosquito net and so forth. But right now, what has happened then is for chronic illnesses, you can't necessarily prevent it, the usual public health way. So what has come as a new approach to it is to make sure that we are able to promote healthy lifestyles, we have changed continually to sedentary lifestyles. We are very urban, especially, you're going to get your fast food, you're going to drive all the way, you don't necessarily exercise as much. So promoting that healthy lifestyle is able, first of all, to prevent the occurrence of something like hypertension, and in some instances able to reverse when it has developed. So that, in essence, then in the long run has, and it's proven, can be able to reduce the incidences of these illnesses and even prevent complications, because complications are very difficult to treat and expensive.
This brings me to a question that is biased, because I fall in the bracket of people who would ask such a question.
Yeah.
When you talk of products, products are sometimes determined by one's age.
Yes.
Now, talk about products for those who are elderly.
So, typically as an underwriter, of course, you would want to understand your risk well. But I'll speak specifically to the experience of Jubilee, where we actually do have a seniors product with a ceiling all the way to 80 years. For Jubilee.
How many years again?
80 years.
80?
Yes, 80.
Okay.
Yeah. And that experience of having covered individuals all the way to, like I mentioned, the spectrum of from young, a child from a J junior product to a J seniors product, we cover you throughout that journey. It's difficult to get such products in the market because often the insurance industry traditionally would shun away from covering that population because it's construed as high risk, right? But then any risk can be priced. And it would be good that, you can be able to get that product and allay the financial burden of going through the chronic illness at that old age and so forth, and just open up opportunities that get you into the ecosystem of care that, for example, Jubilee would offer. Yeah. Yeah.
Okay. One of the things you also mentioned was Maisha F, and we've talked about it a little bit, but then, just give us an overview in terms of what that is about across the spectrum.
Yeah. So Maisha F is a lifestyle. And the way we present it, and the way to access it is we have an app on the Play Store, and we have a few programs. But Maisha F is really a lifestyle. And what Maisha F does is it curates preventive care for different subsets of populations. So I give an example of the programs that we run. Within Maisha F, we have the traditional corporate wellness, where we would be able to go to a corporate and screen the individuals there and be able to offer care that is tailored to them. That is the traditional way to approach it. But then we also have communities for mothers. We call it the Moms Club. I think so far we are about 5,000 mothers. Very active community. And what that community does is, the journey through from conception. There are mothers who are struggling with conception. Yeah. How do you get care? How do you get access? How do you get directed to the right people? How do you get support? The community support throughout pregnancy to delivery. And we sometimes think about these things are very routine. A mother would go to hospital and just give birth, and then that's it. But at the end of the day, that community of support does give them the required. How would I put it? Strength to go through that process. Then we have communities that are tailored to illnesses, chronic disease management programs. And this is where diabetes especially and hypertension comes in. And we also have a mental health program where we are able to support our customers. And actually, this has gone beyond our customers. We actually have built communities that are beyond Jubilee customers. And importantly, what actually ties all this together is a program we call navigation. So we're able to thread a member all through the system, the ecosystem of care that is currently available, and give those options available. This is delivered on a tech platform. We have a Maisha F app. You can go to the Play Store, iOS store, download it. It should be able to deliver things like self-navigation. Who is my nearest healthcare provider? Can I get drugs? And we're building communities into that as well, so that we can be able to push tech into that space.
So what impact then does it have on folks who then are seeking this care? Because we've seen, fine, there's innovation, the things that we never imagined that you could do, that you could get drugs delivered to you, the good kind. And then you can can talk to a doctor on the phone.
Yeah.
I mean, on things that easily 20 years ago you wouldn't be able to do.
Yeah.
But what impact are we seeing that this has on patients that is making life a little bit better for them? Are we actually able to see that there is impact that can be measured and achieved because of these innovations?
Absolutely. I think you could look at it from several aspects. There's the convenience of care. Waiting times in healthcare are a nightmare worldwide. No one really wants to go and sit in hospital and wait for 1, 2, 3 hours. What these tech platforms offer is that convenience of having access wherever you are. And what that access, the convenient access, has done is seeking care is easier. So people are actually seeking care much faster. And in a more convenient way. And that actually then leads to early detection, better treatment. The other bit of it is actually the cost of care. An average telemedicine consult, for example, and I'm not speaking this from an underwriting perspective, just a normal, even if you were to pay it in cash, would be around 1,500 shillings. If you were to walk to a hospital, just the cost of maintaining the brick and mortar sunk cost for that provider would actually push that consultation to an average of, say, 5,000 shillings or so. So the access in terms of finances, the access in terms of the convenience, and you know, what that has also allowed is, whereas specialists would not have been available, for example, in the former northern frontier districts, for example, we're able to deliver that there. And we've seen programs run by hospitals like Gertrude's, where a pediatrician is consulting in Moyale, a pediatrician in Nairobi consults in Wajir, and so forth. That access is actually very important, has actually pushed outcomes for patients. Yeah.
Does it take away from what a person... Now, do these innovations take away from what a person-to-person consult would do? Because like when you go into hospital today, isn't it that they would say, well, okay, let's tell us what's going on with you, let's prick and prod you a little bit, take your blood, take your temperature, take your pressure, etc. Does it take away from any of that if I were to get on the phone and speak to somebody and they say, well, tell me how you're feeling, and then based on 1, 2, 3 you can do XYZ? What?
It actually doesn't.
Okay.
A majority of the illnesses that happen on a day-to-day basis would not necessarily require invasive diagnostics. And I'll give an example of a program that we're running at Jubilee. Instead of going to a pharmacy and getting a drug over the counter, we're offering an opportunity for you to actually consult with a doctor. And the partners that we're working with, in that pharmacy, there is a nurse. If the doctor over the phone wants to examine, the nurse will examine you, and then you will get a prescription. And at a certain point where the doctor feels, okay, no, this cannot be managed remotely, then you're referred appropriately. It's just that a majority of the illnesses that we face the day to day, they don't probably necessarily require that you actually would go to a hospital and have a barrage of investigations, which whereas the cost may be passed on to an underwriter here and there or out of pocket, it's not a victimless cost. It actually is a cost to the healthcare system. Yeah.
Then there's the issue of understanding the possible illnesses you may have. There's always talk and there's always mention of having a health check.
Yeah.
They have all sorts of names and they're branded differently.
Yeah.
The idea is to try and figure out whether you're healthy, and if you're not, what it is that might ail you. Now, when you have a health cover, do health covers consider such costs where I can ask to go through a process that will determine what my health status is?
Absolutely. Actually, I think embedded in all Jubilee covers is an annual wellness check. What we encourage is have a continuous care, have continuity of care. You will find, at the risk of being controversial in the medical space, that a lot of the wellness packages, so to speak, assume that a human being is a chunk of organs, We'll do a heart check, we'll do a kidney check, we'll do a liver check, we'll do, and so forth. This is a patient, and the patient has had a journey over time. And then this follow-up would allow the doctor who's been following up to be able to determine what is the most optimal test. I see, 25-year-old young men being screened for prostate illness. I mean, it's a cost, and like I mentioned earlier, it's not a victimless cost. That is a cost to the healthcare system that would be used somewhere else.
But isn't it better to have that check at that point in time? I'll say this because as someone who has consumed health products for a long time, it then becomes a pre-existing condition, does it not?
It does.
And then you as underwriters, it gives a little breathing space, does it not?
No,
I'm waiting for you to say yes.
No, not necessarily, no.
The command,
Not necessarily.
You see, if you are unwell, for instance, I'm hypertensive, okay? And I have a problem with my blood sugar. Okay, it's a pre-existing condition, and whenever I renew my health products, I declare it. I tell them this is what I have. Okay, now what it therefore means is that the amount that the insurance and the upfront they tell you, we will cover up to 10% of your cover. You are told in advance. Now, why I'm asking this question of whether it is allowed, he has told me yes, they have that package of wellness, is because it is infinitely better for, in my opinion as a layman, for an insurance company, an underwriter, to bear that cost of that health check so that you know. Because there are times you have an underlying condition and you actually don't know.
Yeah, it's true, very true.
You go to hospital exhibiting one condition, and the process they figure you have something else. Again, I say this from experience. You go in with one problem and you're told, actually, by the way,
we might have to look at this one.
That one you also have, but we've also figured you also have this. So from an underwriter's position, this is really my question. The 10% that you normally place as what you will cover for pre-existing conditions, why 10%?
So I'll go back a bit and just answer a bit on the wellness checks. Yes, they should be covered. They are covered. We cover them liberally. It's important for us to actually understand the risk going into the business. But you see, insurance is underwriting, and underwriting is a technical science, in this sense that you are collecting a premium and you're likely to incur a cost that is exceedingly higher than the premium, right? So what underwriting does is then, how would I put it, mitigate the risk, okay? So that when you're accepting the risk, you are not going to have outflows that are way beyond what you've collected as premium. And there are those conditions that you already know, because if you look at an individual who comes in with a pre-existing condition, for example, they definitely would incur a cost.
Yes.
So as opposed to, insurance works on a Pareto principle, 20% will claim, 80% will not. So if you have an individual who will definitely claim, then you have to either price that risk. So usually you'd find that they say, okay, we will accept with this condition, but then we will load a certain amount on the premium. So that the cost of that care that is definite is able to be covered. So that, again, as a business, you have to be a going concern.
Sure. We're going to take a break, but in the meantime, there are many things to be discussed, Doc, but where do we find you? It seems that there's a number that people call, and I don't know if that particular phone is under the table, but people complain that we try to call Jubilee, but nobody picks up the phone. How are we supposed to find you?
So, I mean, we have an omni-channel system of support. You can find us on our website, you can find us on Twitter, you can find us on Instagram, on LinkedIn, and so forth. But we have a call center
with actual humans behind.
Yes, with actual humans. Yeah,
it's not automated.
No, it's not automated. I mean, it's one of those that has escaped automation. Right now, across business, everyone is onto automation, but Jubilee still retains a very human touch. You can be able to call through, and you will find that there will be a human on the other side who will be able to sort it out.
A big issue is information that I would give over the phone, via email, on social media about my health status, because I'm not physically coming into the hospital or into the clinic. And if that is going to be made, if Jubilee is providing this gateway through which I can access this healthcare, you're going to have a lot of my information. You'll have my name, my birth date, my what do they normally ask you for? All those things that they ask you for. But that data privacy and protection comes into play here. How do you safeguard all of this, where because you can't see me, you're going to need to have all the information about me in order to treat me.
Yeah.
How will you protect me when it comes to my data and information?
So we do have, and I think the Data Protection Act actually sort of pushed us very many steps ahead in terms of data protection within the region and the continent. There's a regulatory framework that exists within the Data Protection Act, where any data processor, any data handler is required to maintain a certain level of encryption, minimization of data, and so forth, so that you only collect data that you require. And even when you do that, you have to pass it securely within your network, and you only limit access to whoever will be required to have that, to have access to that data. So cybersecurity, as it were, just protecting the data that you've already collected, again, is a big area of investment, especially for companies like Jubilee. And what we've done is, push encryption quite significantly and push cybersecurity and put investments within that space. The important bit is to understand that the communication and the channels for access are secure channels for access. It's not a random phone call.
Okay.
Yeah, so you'll find that either you're using a teleconferencing tool that has secure encryption and secure networks, so that we ensure that, one, we've protected access in a safe space, but because medical data is especially sensitive, we also ensure that your medical data is secure. Yeah.
Okay. The packages that are offered, or things that you're then able to do whereby you can have access to healthcare the year through, how does it affect cost because of this innovation? We're looking at more expensive premiums, same premiums, are they lower? Because that's one big question that pops up for people when we're talking about healthcare. I have to be able to afford it.
There are exciting times ahead. I think tech is disrupting a lot of spaces, and insurance is one of them. Like I mentioned earlier, maintaining an operation in a hospital, the typical brick and mortar hospital, is very expensive. There are many costs for setup, there are many costs for maintaining staff, and even just the cost in time. Customers come in, they have to wait, you don't have a scheduling system. There's a lot of wastage within the traditional healthcare system. So tech offers a bit of solution in that. Of course, we are still many. I think the world is not yet really ready for a tech-first health system. We are getting there. It will probably, it may be very obvious very soon. The same way, it was very difficult to imagine that you would have money sent to you via text message, right? So we will get there sometime. And the exciting thing about this is, like I mentioned, the access is amazing. Wherever you are, you can access it. It's very cost effective. It's very cost effective because healthcare is probably the last frontier market where we've not commoditized things. You don't know if I have a common cold, I don't know how much it's going to cost. Depending on who sees me, depending on where I go to be seen, you don't know how much it's going to cost. What tech does, it's going to standardize a bit of that and just push that access. And it's going to be, because the ultimate cost of care is less, definitely the insurance market will respond to that.
Okay, so let's break it down in this way. So if you were to walk into hospital today, even if you were covered, by Jubilee, for example, if you were to walk into hospital today and you have whatever issue presenting with, and you hand over your card or whatever it is, likelihood is that you do your triage, whatever, and it's going to come to maybe some 2,500 shillings just for them to look at you, literally. Before anybody has even touched you, then you go sit in front of the doctor, and that goes kaching, maybe 3,000 shillings. These are the numbers that we're talking about today. 2,000 to 3,000 shillings just for consultation. You've not been treated, nobody's drawn blood, nothing has happened, right? They've taken your weight, height, etc., and you're already at 5,000 bob. Okay, whether it's coming off your insurance or whether it's coming out of your pocket. So are we saying now, Doc, that with these innovations, that we could see this money, which folks are currently paying today, reduce significantly. Because you mentioned already, if I'm going to do a telecall with the doctor, I probably spend up 1,500 shillings, and I'm going to do that from the comfort of wherever it is that I'm sitting. I do not have to travel. I do not have to connect. I don't have to do any of that. So 1,500 shillings, and I can talk to a doctor, and I can tell my symptoms, and they can tell me this is what it's likely to be, etc., etc. Right? Are we saying that this 5,000, 6,000, many times 8,000 shillings that you have spent before blood has been drawn, anything has happened, are we actually saying that this money can be significantly reduced with these innovations?
Absolutely. And I'll give a practical example. Right now, our teleconsultations at pharmacies, they cost $1. It's about 150 shillings or so. Whereas if you had gone to a traditional provider, it would cost you upwards of 2,000, 2,500 and so forth.
Not considering travel, not considering
just the inconvenience of, just sorting yourself out and the time that you take. Telemedicine is extremely cost effective. It's very efficient. The convenience in time, the convenience in place, that actually is one of the biggest selling points for telemedicine. And like I mentioned, exciting times ahead, because when you actually reduce the cost of care, what then happens is insurance companies responding to it, less premiums, insurance is more affordable, you have more penetration, you have more access to health financing, and you have a level of protection that allows you to seek care faster. So there are a lot of downstream effects that come from just having that convenience. But just let me come back to for example, what we're running. You pick up your phone, you call 0709-949-000. That's a Jubilee call center number.
City knows that number.
Yes, City knows it.
yes.
Absolutely, and it's human beings who pick it, right? I can confirm that. You pick that and then you say, okay, I'm your customer. I need to have access to telemedicine, right? So what then happens is, we try and thread that for you. We'll say we have X and X providers, or this pharmacy is next to you as a pharmacy teleconsult. The cost, and this is actual numbers that we've seen across the industry, is actually close to 60% less than what you would have paid if you'd have walked into a normal provider. So there's a lot of potential. It's just that adoption may take some time. But I mean, looking at all these things, it's obvious then that we should probably be pushing this a bit more.
Does it preclude folks who are not in urban, peri-urban areas? Because if we're saying that this kind of health, because look, a lot of folks who then are in rural areas, the element of travel, and I'm just trying to imagine, the element of travel is a big deal when it comes to going to seek medical care, right? Or to attend a medical facility. You mentioned, expectant mothers, for example. It's a big deal. We still have an issue where many, many women are giving birth on the way to wherever. And it's an issue, right? So, how would this play out in an area whereby travel is a problem? Even getting this medical care is an issue. How would that play out whereby we would now try to introduce something whereby you can speak on the phone to a medical provider? And I'm not talking about peri-urban or urban areas. I'm talking about rural Kenya.
First off, as a disclaimer, not everything can be treated remotely.
Sure.
But a majority of illnesses that we have on a day-to-day can be treated remotely. One of the biggest barriers to access to care is just physical access, the distance to the next available healthcare providers. And if you come from some rural areas in this country, you'll find it, the next facility is 20, 30, 40 kilometers away. The innovation then comes in at this point. Imagine a situation where you have a child, very remote village. You can't be able to get to the next healthcare provider, but you are able to call a doctor, and the doctor is telling you, by the way, if your child has passed loose stool 4 or 5 times, maybe it's time to be going to hospital, and maybe as you're going to hospital, do 1, 2, 3. It saves lives. And I mentioned earlier a project that was being done by the Gertrude Children's Hospital. There is actually publications from that actually show outcomes for children in rural areas improved significantly. Because then, instead of, in some of these places, it's difficult to get specialized care. It's difficult to even just get a normal GP to take care of the patient.
Yeah.
But you bring in that GP to the patient.
Yeah.
Even if it's not direct intervention, there are interventions that can be done remotely that actually impact the outcome of the care safely and cost effectively.
This is interesting, because then what would it mean? For example, if these same areas that we're talking about, where we know that healthcare and access to it is an issue, what would it cost? Usually we say, okay, if you pay premiums per month or pay premiums per year, what would it cost for somebody who says, look, I don't have the 5,000 shillings a month, Are there packages that can be created for folks who then would be able to jump on if I pay a certain amount? You know how we have the Kadogo economy? If you can buy soap for 20 shillings, can I also access medical care for 20 shillings? And I'll explain that if I put away a little bit of something every day, can I then have access to this every month? So that at some point, if I do need to call somebody, the CT always gets on me for this. It's the community health workers or community health promoters, right? That I can have access to one of them under the cover because I've paid 50 shillings or 100 shillings per week. Is there something like that takes those folks into consideration?
Yeah, so we, in addition to offering coverage over the spectrum of life, we also offer coverage over the spectrum of income. And it's interesting that you mentioned 20 shillings a day. We actually do have a cover. We call it cover Bora, which is about 6,200 shillings per annum.
Oh yeah. Okay.
Yeah. So it's actually 20 shillings a day.
Wow.
Literally, it's 20 shillings a day.
Wow.
So
Okay.
you took the words out of my mouth.
I see.
And with that, you actually unlock the entire benefit of being a Jubilee insurance customer.
Really?
Yes.
What's the entire benefit?
The entire benefit is, cover Bora is predominantly an inpatient cover. So you'll have coverage for your inpatient admissions and so forth. But these communities that I mentioned, this access to telemedicine, all these things, they are available, they're unlocked because, what we believe is, yes, there are different tests, there are different products that, any one of us could be able to go and buy.
Yeah.
But every individual customer who chooses and places their faith in Jubilee should be able to enjoy the same privilege as any other.
And
it doesn't matter how much the premium is. Yeah.
Right. So, and literally, you can actually pay the 20 shillings a day. Will Jubilee take 20 shillings a day, or does Jubilee want me to come and pay you the 6,200 shillings at once? And I may not have it, but is there a basket somewhere where I can be putting in the 20 shillings a day, and that would now allow me access to this healthcare that you speak of?
Yeah, I mean, we're building capacity around that. And one of the things that we actually try and encourage, because we have sister businesses, Jubilee Asset Management, for example. If someone may not be able to pay the 6,200, they can put the 20 bob in a money market fund, and you can be able to use that as a premium. And we've seen a lot of creativity around, affordability of paying premiums. There are those that, you can be able to get insurance premium financing. There are those who opt to take insurance premium financing. And there are those that opt to, create a wallet and then use the interest thereof to pay the premium. Yeah.
Okay.
There is a population of individuals who we refer to as working within the Juakali sector, the informal sector. We are also told that they by far consist of the vast majority of people who actually work or do business in this country, just in terms of numbers. What we've just spoken of seems to meet their need.
Yeah.
But then there's the question of, do they know about it? And what efforts have been made to ensure that cadre of citizen throughout the country actually gets this information, just this bit that we've spoken of?
I mean, even this conversation is informational, isn't it?
Oh, it most certainly is, but you're not here every day, are you?
Yes, absolutely, yeah. So what we've tried to do... That was just a minute. City is really holding me to
It's in fine form.
Yes.
Yeah. we have done a lot of promos, and one of the things that we have done as Jubilee is we have an initiative called Afya Mashinani, where we take Jubilee to the ground. We have partners like the Aga Khan hospitals, for example, where we organize medical camps, and we actually would go to the ground, and our agents would be able to speak to some of these products. And we've seen a lot of uptake. There are other ways that we're working towards ensuring that the sign-up journey is straightforward and easier. Right now, we will keep pushing the Afya Mashinani narrative. So we've done tours around the Rift Valley, Nakuru, Naivasha. We are planning to do some bit more within this year, and that creates a vibe to it. But then again, we're just trying to push promotional materials here and there. We have informational brochures, but importantly, I think trying to demystify it, the best is going to the ground and actually meeting the Juakali and actually saying, by the way, there's a product here that actually works for you. I think that because insurance is actually a personal sell, it's a push product. No one wakes up to say they want to buy insurance.
Yeah.
So the agent actually having that relationship with the customer is what will actually push it up.
Is there room for the customer to give you feedback even as you tell them about the value of the product so that you can actually understand what, yes, they've understood what you've told them, but then there's what they think they need and what they know they need.
Yeah. Yes. So Jubilee, we don't put out products that we think are right for Jubilee. We spend a lot of time understanding what the customer wants, understanding. We conduct a lot. We commission a lot of research on actually almost a quarterly basis. What does the customer actually want? Because otherwise, you'll create a product that you'll buy yourself. And the best way to actually see if then that product responds, customers vote with their feet. Are they buying the product? And for us, at least, we've seen that customers are taking up our products very well, which is encouraging to see that it's meeting a certain need. Nevertheless, because of continuous engagement, you get to understand market trends. Markets are dynamic. You can be able to then, pivot and create products that actually respond to that need. An example is, for example, the young Kenyans. Let me not say young Kenyans as if I'm very... we young Kenyans.
Yeah, actually, you've taken the question out of my mouth because that is actually where I was heading.
Yes.
Please continue.
Who work in the digital space, who work in the gig economy. There are products that actually respond to that. The product that responds to a gig economy because you know that someone is going to get a windfall in 3 months and then they may not get a windfall the rest of the year.
Yeah.
Can we be able to work through a situation a product that responds to that need? So at Jubilee, there's a product for everyone. I literally mean it when I say there's a product for everyone.
Consider starting a little earlier even.
Yeah.
Given the importance of insurance, and actually it is not possible to overstate the importance of insurance. Yeah. As someone comes of age and they're understanding that at some point in their lives they're going to have to look after themselves, say secondary school, say the time when people are about to go to college, apart from just the product, just ensuring that information is there so that it is understood. Because health insurance insurance does a lot more than just cover you for health. Yeah. It does very many other things. Very true. And a lot of the times,